Hello, everybody. I'm Dr. Nikhil Loya. We are very, very happy to welcome you all with this new venture which we have started for the ISPE, where we are going to have podcast with all our seniors and mentors and learn from them a lot, as always they have been doing for us. So the first episode which we are recording today is with Dr. Menon sir. PSN Menon sir is a big institute in him, and we don't need to introduce him. He has been one of the doyen of pediatric endocrinology when it comes to India and perhaps globally also. He has done a lot of work in the field of pediatric endocrinology, starting from AIMS. He went to Kuwait, in back in India now, and also in ISPE and in social platforms. He has done a lot of help to all the young pedendos and also to the patients suffering from various disorders of pediatric endocrinology. We welcome you, sir.
Thank you, Nikhil. I look forward to an interesting session with you. Yeah.
Thank you very much, sir. How are you doing, sir?
I am fine. Thank
So,
you.
how are things back after coming back to India? You are doing
Uh,
well. Where are you right now, sir?
I am at the moment in Gurgaon. I am not in active clinical practice at the moment, but actually doing only most academic works. Most of my time is taken for editing the textbooks in pediatrics and pediatric endocrinology that we have authored and edited. So continuing the editing of these books go on. In addition, I also work as the editor-in-chief of the Journal of Pediatric Endocrinology and Diabetes for the Indian Society of Pediatric and Adolescent Endocrinology. And I spend most of my time actually doing teaching sessions on Zoom or live or in actual person with many medical institutions around the country, mostly in and around Delhi. I enjoy these sessions with the younger budding talent in pediatric endocrinology.
That's so nice of you, sir. It's because of you and your dedication we are learning so much every day in pediatric endocrinology. Um, so let's begin with our session of podcast, which we have started afresh. First thing I want to know from you is that you have entered in medicine at the times when things were very India was very raw at that time. It just got independence, and a few years later to that. So, what exactly drew you to the medicine part of as a career you wanted to do medicine?
I come from a big family. I have elder brothers also. So my elder brothers actually had taken up engineering and economics as their career. So it was natural that I would look for something alternative. So my parents guided me that probably medicine is one options that I have as a career, educational as well as job career in ahead. We had some role models actually in the family also who are actually doing excellent in a medical college as faculty working in different disciplines. So that prompted me to take up probably the career in medicine after doing my plus two levels at a young age. It
That's
was not
great.
an easy decision. It was not an easy decision. I was not very sure immediately after joining the medical college whether I have made a right choice. It took time to build in to develop a fascination for the clinical medicine.
So perhaps it was more of a family and combined decision rather. You were also an
Yeah, it is mostly family with a combined decision.
Okay, sir. Okay,
Yeah.
that's great to know. I think majority of us in that age, very few had that vision because of family used to guide us a lot, and family's vision was our vision, I guess. But let me know a little bit, since you have spoken about your family. How has been your early childhood, your school time, your family, and how it has shaped you, and not as a doctor but as a person and as an individual. You're standing right in front of us right now.
Actually, the family has been very supportive. Actually, we come from a family where my parents were very academic oriented, always encouraging us to do well in academics, not necessarily top the classes or the examination, but also to learn. They took us to different avenues where we can interact with other elders or colleagues in the field and see that learning process is something good and that improves your vision, outlook, and the way the society looks at you. That is one thing which you learned very young age. The school and the colleges which took me, actually nowadays plus two education was in a college, in a university, whereas schools
Mhm.
used to give only education
Mhm.
up to class 10. So my teachers are excellent. They were not only just good educators but good storytellers. Storytellers in just that they would always tell us about the great stories that are there. Not this was not part of the standard curriculum. They also introduced us to world of literature, arts, medicine, engineering, and other things in the additional time whatever we had. And they always encouraged us to participate in other activities. The school actually opened up my vision as to. I can very clearly say that medicine was not the only one that was coming to me at that particular time. I was good in maths, but and physics. So I initially thought that should go for something like a career in physics or maths, do some higher studies, and go for a doctorate, like was some of my teachers. Medicine was far beyond at that particular time. But as we started learning, the teachers really taught us that these are not difficult subjects. These are subjects that you can master and have an authority if you put your mind into it. So the teachers were very good guides in deciding whatever career that you're choosing, you should follow it steadily, thoroughly, and with enthusiasm and a liking for the subject. That was the school. It was in the college when you were studying for 12th that I had to make a career choice whether I should go into the medicine line or a line of engineering or other. It became clearer to that particular line that I can choose medicine. But one worry at that particular time in my career and during the period in which you were studying was that once you choose a career towards a particular line, it was very difficult to change it actually in the middle if you found it difficult. So there was this always worry that am I built for becoming a medical practitioner or a medical teacher? I was relatively young, not so well built, not so healthy for that matter compared to my brothers and sisters. So there was always this worry that whether I will be able to pursue a long, tenuous career in medicine. But luckily, it went on well.
No, no, I think it has been remarkable what you have done. But the only thing which I'm able to make out that you have got a lot of learnings not only for your family but from your teachers also.
Yes.
So do you think you have carried them throughout and till now you are carrying them?
Yes, I think these teachers have been role model for me in one way or other. That probably took me to a career into a long career of medical education. And I always thought that what I got from my teachers from very young age to entering into medicine, and also the teachers in the medical colleges and institutions, I always admired them. I admired the way they took interest in training me, not only in teaching. And I really learned the difference between learning, education, teaching, all that. Actually, everything is a process. We are only educating ourselves. And all others are actually a tool in that process. Your teachers actually tells you the varied aspects. They take you into that there is only not one way of doing things, there are multiple ways of doing things. And there are multiple aspects to one particular clinical or other medical or even
Hmm.
problems in life, and
Hmm.
that can be solved. That aspects was taught to me by teachers. So sometime in the way after doing MBBS and also after doing MD, when a career opened out to me to become a teacher in medical college, I really looked forward to it. And luckily for me, I could also pursue a career, a training format in the field of medical education abroad, which also widened my outlook as to how I help students learn better. So that is actually, I think my teachers are probably responsible for inculcating that belief in me that I can be a good teacher.
That's so nice to hear. I think perhaps what I'm able to understand, correct me if I'm wrong, you have started your career with a combined decision of family, and along with your family, your teachers have played a major role in shaping you as a doctor.
Yes, very much.
So
I
I
can
think that's what we
thank
also
you
need
quite
to.
a number of teachers just during in my elementary school whose photographs always come upon me whenever I look to something. I have also very good teachers in the undergraduate education and excellent teachers during the period of post graduation, and some of them have been excellent role models for me as to how to proceed in life, how to proceed in your career, how to behave as a efficient, excellent human in general life.
Great, sir. Nice to know. But then, how did you ended up, or how did you decided that you want to pursue pediatric endocrinology? And I mean, what made you take the path of pediatric endocrinology?
I think it did not come naturally.
Okay.
When I did my MBBS, I was not sure what I want to. During the fifth year and during the internship, I realized that I am not cut out for surgery and surgical disciplines because you get that inside feeling that
Yeah.
this is not my field.
Yeah, that happens.
Not that I did not like surgery or surgical disciplines. Some of the surgical teachers in surgical has been excellent and helped me in deciding what career I should follow. They have been. But MBBS, knew that I am not made for surgery and surgical disciplines. Then I took up clinical medicine. I thought that instead of medicine, I was more attuned to pediatrics during my internship. That really opened up my liking for pediatrics. So I could get into pediatrics into a good institutions I call India Institute of Medical Sciences. I must thank my medical college, that is one of the best in South, the medical college at Kozhikode or Calicut in Kerala. And many of the teachers who trained me in various disciplines in undergraduate education were actually postgraduates and super postgraduates from All India Institute of Medical Sciences.
Oh, okay.
He told me that if you can aim to go to AIMS, that is the best institution to be, and attempt to it. So I went into pediatrics after competitive exam and
Uh-huh.
led to AIMS. It was an altogether difficult site for a person coming from down south
Yeah.
to up to Delhi. It was a change in everything.
Yeah.
During my pediatrics MD, I was just trying to learn more about pediatrics and how to manage children than a particular interest into any particular super specialty.
Mm-hmm.
Then during the period of my senior residency, what we call as
Okay.
registrarship, that is the time I met a lot of people in the field of various disciplines in pediatrics,
Mm-hmm.
working in pediatric cardiology, neurology. I
Mm-hmm.
was immensely fond of my teachers in pediatric cardiology.
Okay.
Yeah, but I was not sure whether I should take up a career. It was during the first international conference, which was held in Delhi in 1977, that I came across pediatric endocrinologists for the first time.
Mm-hmm.
And when I became a faculty after my senior residency, for
Mm-hmm.
first 2 years, I was doing just general pediatrics, doing
Okay.
teaching pediatric postgraduates, looking after the general outpatient clinic,
Mm-hmm.
the ward work, critical care.
Mm-hmm.
It was in the third year of my faculty position.
Mm-hmm.
Professor Om Prakash Gai, my professor and benevolent guide for all my career, told me that now time has come, you just not do just general pediatrics but do something more, because this department needs more
Needs. Yeah.
specialized people, because this is a top institution and we cannot have just go along with general pediatrics. That's needed, but we also have to choose a specialty like your colleagues who are elder in the department.
And this was which year?
This was
1977.
1981. He told me to do that. In 1981, he told me that you have to see whether you like pediatric endocrinology, but I want you to take up pediatric
Okay.
endocrinology and metabolism. Then he said, I don't have a person in the department who can guide you. So you work with the Department of Medicine, where there is a well known figure in the field of endocrinology and diabetes, Dr. Manmohan Singh Ahuja. Dr. Ahuja is probably one of the great grandfathers of the field of endocrinology in India.
Yeah.
Took me to him, hand held me and took me to his office and told him, this is Menon, and I want you to work with you for 6 months or as long as you want and see whether he has got the intuition or the liking for the field of endocrinology. How you do it is your favor. So Dr. Abu just told me that the aim is that you start seeing patients in pediatric endocrinology in your own department and
Mm-hmm.
present to our team of endocrinologists.
Okay.
This department had four other adult endocrinologists.
Okay.
So we used to start a clinic all by our own as a pediatric endocrinologist in
Oh,
the year 1982.
under the guidance of
Under
the
the
adult.
guidance of Dr. M.M.S. Ahuja in the Department of Pediatrics, we
Okay.
would ask every colleague, because it was new, we
Yeah.
would ask every pediatrician in the department to send patients which they thought are endocrinological problem
Uh-huh.
to us, and then we will see. Every Monday afternoon, we will select these cases and present it to the team of adult endocrinologists. And they will, some of the problem they knew how to manage.
Yeah.
Pediatric aspects we
Yeah.
were good, but subject knowledge was much more with them. But we both were sometimes unsure how to manage. So it went on for 2 to 3 years like
Okay.
that. And I am indebted to Professor M.S. Ahuja, Professor J.S. Bajaj in the
Okay.
Department of Diabetes, then Professor N. Kochupillai, who is the authority in the field of thyroid and newborn screening,
Mm-hmm.
Dr. Vinod Kumar, who was in the field of growth and growth hormone,
Okay.
and later with Dr. Karmarkar, M.G. Karmarkar,
Mm-hmm.
who was actually introduced me to endocrine biochemistry.
Okay.
That is the first
Biochemistry.
time I realized that this is a discipline which can incorporate clinical medicine with a lot of physiology,
Mm-hmm.
metabolism, and also laboratory knowledge, and incorporate all of them into a beautiful um, collection of clinical medicine with physiology and biochemistry. It was very innovative and very challenging at that time. That was what fascinated me to stick into pediatric endocrinology. So that was the beginning of the pediatric endocrinology. Later, everything else opened out. All India Institute could send one of its faculty members for training abroad in the field of pediatric endocrinology. And I was lucky to go to UK, to the city of London, the Great Ormond Street, the Institute of
The
Child
Mecca
Health,
of pediatrics, what we
yeah,
call.
and work with probably some of the champions in the field of pediatric endocrinology, like Charles Brook, who
Oh,
wrote our book on
yeah.
scientific foundations of pediatric endocrinology. So it was very, very difficult actually for me
Mm-hmm.
work, understand the way pediatric endocrinology works in other departments, especially abroad. And then I was also lucky to work with some of his colleagues like Peter Heinmarsh, who was actually a very bright talent at that particular time. And I had a chance to meet a lot of other experts like Dr. David Milner,
Mm-hmm.
and people who have been working in the field of different aspects of pediatric endocrinology, like hypoglycemia, like Dr. Ainsley Green in
Mm-hmm.
pediatric hypoglycemia and
Mm-hmm.
hyperglycemia. A lot of people we could meet. Later, of course, after coming back from training, I could spend a shorter time with other experts in the field. Thanks
Mm-hmm.
again, All India Institute.
Mm-hmm.
I would say that the best of that experience was with an Australian pediatric endocrinologist, Dr. Gary Watt.
Carry on. Yeah.
Took me into the field of how to deal with ambiguous genitalia and DSD. I owe a lot to him for the development of the first intersex clinic. At that time, it was called intersex clinic. Now it is known as DSD clinic, which is done every week once.
Mm-hmm.
The
Mm-hmm.
pediatric surgeon, geneticist like Dr. Ishwar C. Verma,
Mm-hmm.
Dr. Rohatgi, Budula Rohatgi was the pediatric surgeon. Then social worker, a psychologist, an endocrine biochemist, and also a pediatric radiologist, Dr. Arun Gupta. A
So this
combined
was when, which year you are talking about?
which we started in the year 85.
85. Oh, that's way long back.
Yeah, very
I was
long.
not even born at that time, to be
No, I
honest.
think this was the probably the first pediatric DSD clinic in the world. And
That's
Dr. Garivan told us that the amount of patients that we see in a week or in a
mm,
month
mm,
are seen probably in 2 to 3 years in the in any other part of the world. And he brought in a lot of other people working in the field of pediatric endocrinology as well as in the field of DSD, like Dr. Andrew Sinclair, to come and help us in establishing genetic studies and other studies. First, we perfected the studies on imaging. Then we went into routine genetics like
okay.
karyotyping and fish and others. Then we went into studies on how to identify genes, receptor studies. So knowing people, working with these people helped us to follow. Also, we had a chance with one of my colleagues, my contemporary Dr. Amini, who is no more at the moment in adult endocrinology, developed an interest in adrenal physiology.
Okay.
And he brought in Dr. Magdalene Forrest from Paris and Dr. Nathalie Josso, again from Paris, to help us with the adrenal studies. Then we started calling people because Professor Ghai and Professor Ahuja was the opinion that
Mm-hmm.
instead of any faculty, including me, going
Mm-hmm.
abroad for a training, it's much
Mm-hmm.
better to bring in a faculty member from abroad who is
Okay.
versed in a particular field of endocrinology or pediatric endocrinology, come over,
Uh-huh.
stay in All India Institute for a period of 1 week, 2 weeks, 3 weeks,
Okay.
sometimes even a month or more,
Okay.
interact with the faculty and the residents and develop that particular field. So we were lucky. The first was Michael Ranke from Germany, from Munich. He came and helped us to develop the growth clinic, our
Yeah.
growth department. This was followed by Dr. Tanner, who came and helped us how to make our own charts. Instead of the British Tanner charts,
Yeah.
how to use the ICMR charts prepared by Dr. Ken Agarwal and all, make the first growth charts. So we made a hand-drawn growth chart in 1980s, made out of the ICMR low socioeconomic status study from
Mm-hmm.
Agarwal. And by that time, Dr. K. N. Agarwal and his team has come out with a beautiful
Yeah.
first charts or growth charts in India.
Yeah.
We actually converted, and my own colleagues like Dr. Vijayalakshmi Bhatia developed, who started working after training in USA, came and
Mm-hmm.
worked in Sanjay Gandhi, started making the first locally made growth charts from this particular data available to everybody as charts, which is they actually used to publish everywhere. Some of my students actually took up careers in pediatric endocrinology by doing thesis in during their MD time. So we had people who had done work in the field of uh, that also helped. For example, you must have heard about Dr. Ram Kumar Menon, who is
Yes.
an
Yes. Yes.
editor in Dr. Sperling's book on pediatric
Yes. Yes.
endocrinology.
Yes.
He is our own student
Oh.
who worked actually in neonatal endocrinology in the study of antidiuretic hormone in newborns.
Okay.
Dr. Anju Virmani came with the study on hypothyroidism undetected in children with what we call as idiopathic short stature.
Okay.
And then Dr. Vijayalakshmi Bhatte and a lot of other people came.
Uh-huh.
And they also taught me
Mm-hmm.
what I did not know, their own views. So I always enjoyed this young talent helping me, always questioning my wisdom, and always giving me some startups in between as to what more to think. And I am indebted to all the students who have come and also colleagues, which helped me. For example, we did a first studies on the islet cell antibodies in diabetics in type 1 diabetes. At that
Mm-hmm.
time, it was used to be young diabetics, what we call as everybody below 30.
Mm-hmm.
Dr. Anju Virmani did a commendable work along with us in this particular field.
Mm-hmm.
My colleague from Nepal, Dr. Bicha, did first studies on characterizing the HLA of
Mm-hmm.
these children. Then one
Mm-hmm.
of my students who actually would have loved to do endocrinology but became a well-known pediatric cardiologist down south, did the studies on autoantibodies of thyroid as well as celiac and adrenal antibodies. So many students actually taught us how far actually we can go in endocrinology. So it is not my own experience. I
Okay.
think I must thank my teachers. They really guided me. I must thank my colleagues at that time who supported me in starting a clinic and also the staff at the clinic. And also, I am forever indebted to my students who take up a critical problem and we work together with our limited resources. And thankful to all the funding agencies which could give us funds for doing research like ICMR, UNICEF, WHO, and finally the National Institute of Health in USA. I
So I
am
think what I'm able to make out that you started in India, then you learned a lot of advanced things,
yes,
then you came to India
yes,
and you asked other people to join together
yes.
and to develop the department, and further your department then bloomed as a tree, and then gradually it has beaten the fruit, and a lot of young people, your young people, and for us they are teachers now,
Yeah,
so they
actually,
have grown and they have shown the path or guided rather, or they have taken the torch of pediatric endocrinology further.
actually,
One
I,
good thing I Yeah, sorry.
I just happy that a lot of people from younger colleagues of mine,
Mm-hmm,
not
mm-hmm.
so senior as me, but younger colleagues, also helped us in developing. And I am forever thankful to one person in particular in India for developing pediatric endocrinology. It is Madam Dr. Meena Desai.
Yeah, yeah.
In our time, there was no pediatric endocrinology conferences.
Okay.
He organized, with the help of ICMR as well as the British Council, the first
Mm-hmm.
national conference on pediatric endocrinology in Mumbai.
In year.
Her colleague, I think I also must thank her colleague, Dr. Priska Colasso, who was her understudy, the doing all person during that time.
Yes.
They organized, and what really made me understand was they organized this conference in Bombay, and with the funds provided by ICMR, they asked all medical colleges to
Mm-hmm.
send at least one faculty
Mm-hmm.
interested in the field of pediatric endocrinology to
Mm-hmm.
come, stay, and attend this workshop, this conference, which was attended by a team of endocrinologists from UK, USA, including Maria New at that time.
Okay.
Yes. And it was probably these type of things are not done. We usually conduct conferences, people who are interested register. But sponsoring future faculty for these conferences and develop a consortium of faculty who will work together in the field of pediatric endocrinology was something which was taught to us by Dr. Meena Desai. And I
And this was which year, sir? Which year you got this
was in the
conference
year
from?
1980 of
Okay.
this. And She actually opened out to us the ways of how to organize, be together as a group of pediatric. It was only a chapter of 8 people in the Indian Academy of Pediatrics, which further became a big chapter, went up to 40 members, and later became the full-fledged Indian Society of
And
Pediatric.
now we have 1,000 members, I guess, more than 1,000.
I must really thank not only Meena Desai and Dr. Piska Kolasu, I must thank Dr. Palani Raghupati from Vellore, who was actually, and Dr. Anna Seman, who joined later. These were one of the few people who were initially trained abroad and who came back and started these disciplines in their own institution. Later, we had, of course, Dr. Nalini Shah, Dr. Sudha Rao, Dr. Vijayalakshmi Bhatia, Dr. Vaman Khalkat, all came from after training abroad and helped us to expand the field of pediatric endocrinology.
I think with that, I'm able to see how the things have grown up. Like, in a nutshell, you have given so much of information. I am so delighted and I am so thrilled to know that how it has evolved over a period of time. And thank you so much for sharing that with us, sir. The next point which we want to know is that younger colleagues or younger friends of ours who are in training or who have just started their practice and all that, what do you think they should carry with them and what they should not carry with them so that they can become a better doctor, better person, better pediatric endocrinologist?
One thing is that we should always, number one, I felt that we are pediatric endocrinologists, but we are number one pediatricians. So it is our duty
Well
to
said.
educate all pediatricians about the need to develop a specialty or an interest in the field of
Mm-hmm.
pediatric endocrinology. This
Mm-hmm.
runs for any subspecialty, whether it is cardiology, neurology. So if we sit isolated in our cubicles as pediatric endocrinologists and do not interact with all the students who are coming for training in pediatrics
Yeah.
as well as in pediatric MBBS curriculum. This is one thing which I learned again from AIMS.
Okay.
Because was in our days one of the first institution which you
Mm-hmm.
have integrated curriculum.
Mm-hmm.
Integrated curriculum means the topic of, for example,
Mm-hmm.
diabetes was taught to the undergraduates in
Mm-hmm.
seminars, which
Mm-hmm.
lasted for maybe 2 hours, where all aspects of diabetes like epidemiology, physiology, clinical features, investigations, management, by different faculty in different parts of different disciplines.
Mm-hmm.
For example, it was a combined seminar, so in
Okay.
which I was also invited to join to explain the part of presenting in pediatrics as well as diabetic ketoacidosis. A gynecologist or obstetrician will come and say something about gestational diabetes.
Mm-hmm.
Adult diabetologists would speak about the management with insulin and other medication.
Yeah.
A biochemist and a physiologist will come and tell us about what is the, in a continuous lecture series that was going.
Yeah.
It was never taught in my undergraduate education. I was taught diabetes as a topic of medicine.
Yes.
So I think it is very important for pediatricians to join such ventures and be a part of combined teaching or integrated teaching of all disciplines. This applies to more example would be that of the study of DSD. A study of DSD only done by a pediatrician or a pediatric endocrinologist will forever be incomplete subject. It
Yes.
needs an embryologist or an anatomist and a physiologist who explains the development of hormones,
Mm-hmm.
the pediatrician who tells us about the different manifestations,
Mm-hmm.
gynecologist who deals with the problems later in adult, an adult physician who manages the problems of all those happened in the younger period, what happens during the adult life. And finally, a surgeon who or a urologist who has to do a lot of surgery in these patients. And finally, now we speak about gender euphoria and everything, the importance of the psychologist in this. So unless all these are integrated into the training,
Mm-hmm.
it is not possible. So, number one, pediatrician should be magnanimous to be part of a team, number one. and also say that this is my field. That type of cutthroat competition should be avoided. We should be together with all specialities in development. And we should not think that it is beyond us to teach an undergraduate student. We are super specialists. We should not be doing only some specific aspect of pediatric endocrinology,
Hmm.
forget the rest of it. I think we should also be joining with all other specialists, especially critical care and general pediatrician, in making them understand how better we can help in the management of a child. So this is one advice I have for pediatrician, which
So
is what I have learned from
yeah.
my
So
mistake. Because I
so
used
what?
to have this fascination that this is my patient, I am the one to take this, I should be doing everything. I used to be a young pediatrician with all these things, used to be fighting on all this. But
Yeah.
age matured me. I have learned to respect that everybody matters. Even the youngest person in the group who has a comment should not be ridiculed, should not be brought down, but his point or her point should be listened to. And if it is wrong, we should be the people who should be correcting the these aspects rather than just taking over management. I think if you do not distribute
Yeah.
whatever knowledge you have learned
Yeah.
amongst your colleagues, it is a waste of.
So I'm able to make out with a nutshell that you have to be a good team player, and
Yes,
the team has to have multiple people, and you have to keep your ego down,
yes.
and everyone matters. I think the bottom line I got from you is that everybody matters, however
Everybody
small or
matters,
big that person is.
including,
And
for example, how a dietitian matters.
yeah.
The management of not just diabetes, but
Mm-hmm, mm-hmm.
nutritional disorders. We decide that this we will give. As undergraduate, in protein energy malnutrition, I used to be taught about the government oriented or the NGO oriented
Yes.
special food.
Yes.
But I learned from my guru
Uh-huh.
that you can make any amount of all this food stuff. But
Mm-hmm.
it is a child who has to eat this.
Yes.
He is or she is not willing to eat this. How are you going to do it? So your
Mm-hmm.
all your textbook knowledge is of no use unless
Mm-hmm.
you get into his person's mind and see what prevents him from eating. What or whatever. I think even in our management of obesity or diabetes or other nutritional disorders, it matters a lot to understand the psyche of the child who is affected with the disease rather than just force your well-known diabetic or metabolic confirmed ideas of nutrition and activity. You can tell physical exercise is needed, but what prevents the child from doing it is also important.
So I think what you're saying is that we should not have a one thumb rule for all. It should be individualized and customized, and we have to take everybody into account together and then go ahead when it comes to patient and in general thinking. Well, thank you so much for that. That's really shows how what I'm able to make out from you is that what old diabetes management. Let's just what I'm able to. I'm just expressing in my way. Old diabetes management was mixed start twice, and now it has changed to basal bolus since few years. So it is customizing to the individual and changing the treatment for the individual rather than the individual for the treatment. So thank you
It's
so
true.
much for that.
It is true. I
That's,
think one example is that we make consensus guidelines.
yeah.
I find that currently the younger PGs, younger
Uh,
residents, and
uh,
even younger faculty members,
uh,
during our case discussions in the ward or
uh,
in groups away from patients,
uh.
saying that no, this is not what is written in this consensus guideline. This
Okay.
is what we should follow. For example, we can say that multiple daily injection regimes are probably the best, but you have to look at what is affordable for the patient,
Yes.
what
Right.
can be provided by the government cheapest to the
Yes.
patient,
Yes.
rather than insist that no, we will disregard all these combined old insulins. Some things will work for some people depending
Yes.
on their financial, social, and other status. We have to understand it. We would say, for example, my colleague Dr. Anju Urmani recently wrote about in IAP about importance of cord blood screening for hypothyroidism. Ideally, as a highly trained person in neonatal thyroid screening, I would say that a dried filter blood spot is probably the best method for when you
Very
look
true. Many of
for.
us have that. Yeah.
If your aim is that get as many children screened as early as possible, any method is good, depending upon what is the system in which you are working. Not everybody is
Yeah.
working in a name, not everybody is working in a district hospital. If your aim is that you have to catch every single child born, whether at home, whether in the periphery, then you may have to change consultant
Yeah.
guidelines. They are actually the best methods. But you have to change your practice according to the norms in which the family lives.
I think you answered my next question before I asked actually, how do you handle this information overload which is happening? So I think what wisdom you are imparting on us is that we have to individualize, we have to see, and we have to take a call rather than just following whatever is given in the guidelines and all that. I'll move a little bit away from pediatric endocrinology to touch upon you as an individual. Uh, how, I mean, what I'm able to make out right now in this competitive world, I think it was competitive even when you were in your initial days of your career, but still, to integrate both family, social life, education, and our passion, uh, it's very demanding. So how did you maneuver around, and what do you think is the most important thing to keep in mind while doing anything in life?
I cannot say that I was probably successful in all those aspects.
Okay.
Being a faculty in AIMS, I was constantly driven actually to excel myself as a good teacher because I have to be a role model for my students. AIMS
Students.
actually attracts the best undergraduate students after
Yes.
20 exam.
Yes.
Everybody is a brilliant student. Some of them know much more than you. So to keep up to their standard was an effort. It took
Okay.
extra time to
Okay.
prepare, for example, to give a lecture or a clinical class without any warning, without any prior preparation.
Mhm.
You have to
Mhm.
know the subject yourself. So
Yeah.
to keep up to the best of my knowledge made me that I have to read more, dis- discuss more, re- listen to experts, and that took a lot of time. And then you have to be on the top of the research also. So it took lot of my family time from
Okay.
my which would have happened otherwise. So my family is, if I say that I did best for my family, I don't think it is correct. I think my family accepted my role that I am a faculty in a top institution and I need little more time. I think I must thank my wife for that. Actually, she saw it actually.
Yeah.
In the very young days, she understood that and she took care of the children
Okay.
very well and all other family
Mm-hmm.
responsibility. So I must thank her because without her due support, it would have been difficult. I wish that I could have spent little more time as for my children.
Okay.
Of course, I the very difficult career that I used to get up very early in the morning,
Uh-huh.
go to hospital at around 7 o'clock because I have a postgraduate session from 7 to 8. Then
Okay.
classes starting from 8 to 9 for undergraduates. Then the clinical work. Then come back in the evening after every clinic is open. The clinics, evening clinics do not stop at sharp 4 or 5. It goes till
Okay.
the last patient leaves. So
Yeah.
sometimes we have to close the door, lock up the outpatient clinics,
Hmm.
then come back home
Mm-hmm.
at around 8 o'clock. Then we have to do some other academic
Yeah.
additional institutional work. So I was always an early starter and a late comer home.
Okay.
And sometimes my children later in life used to say that we hardly saw you.
Okay.
So that is one part of taking up a high profile, high academic, high demand.
Demanding career. Yeah.
So at one point of time during the counseling of my first, eldest daughter,
Mm-hmm.
like everything happened that you are a doctor, you are a pediatrician, you are a faculty in a good institution. So everybody
Mm-hmm.
thinks that your children will take up you, follow
Uh-huh.
you, and take up medical career.
Uh-huh.
My first daughter was an eye opener for me.
Okay.
We went for counseling when she was finished at plus 10th grade and went for plus two.
Yeah.
It was a counseling session in DPS school where she was studying. So the counselor told me that she is open to any other career other than medicine. This is after counseling. So I had to had a face-to-face talk with her, and she said,
Mm-hmm.
"Papa, I think I see your career. I think you have no time for anybody else except for your career. I want to do something which is more dedicated to social and other aspects of life."
Okay.
Of course, chose to be a journalist.
Okay.
That is her decision. I
Yeah.
think the difficult medical career was opened to her by me. Maybe she is actually doing well in her profession. She is doing excellent. But we have a feeling, many of the time, medical fraternity thinks that their children also should follow them.
Yeah.
Not, which is, we should not try to force these beliefs, probably built
Okay.
by yourself or by family members or the society in general, that everybody has to follow their own parents. That should not be. Like my parents never told me to become them like them. They told me to become a doctor. So I should also be open minded in dealing with the same attitude I have followed when I am was also asked to be a counselor for students who are joining for MBBS in AIMS as well as for post graduation. I used to do a counseling trying to find out what is the real interest of them. We have of course seen children who
Yeah.
are actually forced by parents and all to take up.
Yes. Yes. Yes.
So family number one. Number two, I told you that that early training in the field of medicine and medical made me think that I am should be a good medical teacher in addition to being a medical consultant. Let's just not be dealing with patients alone. I should also be able to impart some education to the students. So that made me take up a course and undergo training in medical education, which actually helped me to talk better, convey better, and impart education much better to my students. And I think many of my presentations look better primarily because the effort I had received from the School of Center for Medical Education
Mm-hmm.
at
Mm-hmm.
Dundee in Scotland.
Okay.
Ronnie Harden and his team chiseled us and made us very good teachers. It was actually, so we have actually in India a consortium of medical educationists involving several other institutions like JIPMER, CMC Vellore, uh, the St. G.S. Medical College, Bombay, all are a part of a medical consortium, and you see a lot of medical education is coming up.
Okay.
Important. Actually, we all know a subject, but how to impart the education into students and facilitate their learning is important. So,
So, so
they
they deal with the teaching part, how to deal with the teachers and all
we
that.
also need, we
Yeah.
have very good experts, but
Okay.
some very good experts are not very good teachers. Some very good teachers are not probably the
Yeah.
best people in the field of that. But education and providing education is an art by
It's
itself.
an art. And I think you have been a wonderful artist, sir. I must appreciate that. Having said that, we'll move to the next section of our kind of rapid fire. We want a short, brief answer in a short bursts. So I would like to ask a few, maybe a little bit of spicy questions, but a little bit of we need to know a little bit more about you. We'll be very happy to know that. So, I want to ask you two places. I'll give you option, which is close to your heart and which is close to your, Delhi or Kerala. Choose one.
Kerala.
Okay.
Why? Because I think its beauty, its charm, the way I was educated in
Yeah.
undergraduate, but my friends, my family. But I would not, given that if I had not come to Delhi and been in AIMS, I would not have been what I am.
Agreed.
But
So
that liking for my home state is always there.
So perhaps you got a lot of childhood and emotional connect with Kerala,
Yeah.
if I'm not wrong. Yeah, and if you have been also in England, you have been also in a lot of other places, but a significant amount of time you have spent in Kuwait. So
Yeah.
India or Kuwait, which is a better place to live and which is a happier place to live?
India, of course.
Okay, why do you so?
There's nothing to compare with India. I think we complain a lot about the overcrowdedness, the noise, the voice,
Yeah.
the dust. But
Yeah.
India, altogether, India is much more happy place. Here, people love each other,
Yeah.
help each other,
Yeah.
and they are there for you all the time.
Yes.
And we do not, and we will. I think it's a stay abroad in any country is good
Uh-huh.
because then only we sometimes start valuing
Yeah.
our own liberty, our
Yes.
own ability to for compassion,
Yeah.
society recognition of poor versus rich, and the attitude to develop sympathy and help towards them all come
Yeah.
from India. It will
There
not
are a lot of people who comes with a lot of jokes and all. One of them, which has been a valuable, they say that I valued my country India better when I started living out of India,
definitely.
and I
I
think
think
it's
I
it's
agree
it's a
with
very
you.
good say, if I'm not wrong.
I agree with you. I think we learn the value of our country only when we go abroad. How adjusting we are. I see colleagues from other countries coming
Yeah.
and finding it very difficult
Yeah.
in
One habit that has changed your trajectory in pediatric endocrinology. One habit.
reading.
Reading.
Yeah.
Oh, fascinating.
I think you have to read. The minute you stop reading, then your knowledge stops at that point.
Mm-hmm.
You may say that you can listen to people. I also
Mm-hmm.
sometimes say that listening is, but listening
Mm-hmm.
doesn't stay.
Okay.
Reading stays in your mind, in your brain. It remains.
Great. Nice to know that. Like you have spanned out your career a lot from young age to middle age to seniority, and now kind of imparting whatever you have learned. So, in last 5 years of your period in pediatric endocrinology, what you have learned new or what you believe about medicine much stronger in past 5 years?
The more I am learning now is about the importance of genetics
Okay.
at the moment. Uh, Even though we were trained with a very good geneticist, Dr. Ishwar C. Verma, in my undergraduate,
Yes.
postgraduate,
Yes.
and we had a very good genetic
Genetic department.
laboratory
Yeah.
also in the department, which also is imparting a DM course in clinical genetics. But we learn about the wonderful world of genetics, how it involves, and how it copes us to prepare for managing diseases.
Medicine. Yeah.
It is not about diagnosing disease.
Okay.
Because we, as young students, we are always looking at genetics as a
Diagnosis.
diagnostic. No,
Yeah.
how it helps in evolution of a disease and
Mm-hmm.
how it interacts with different aspects like environment,
Mm-hmm.
biota, and all in
Mm-hmm.
producing a disease state and keeping us healthy is something which I am learning more now in the last 5 years, which was not probably I did not get much time to learn about it. Now I have more time, so that is one thing which is fascinating me now.
Fascinating. Anything you would like to go back and I will not say completely change, but to add or something in your career of pediatric endocrinology, anything you would like to change or add or modify rather?
I would wish now that pediatric endocrinology, like many other subspecialty in
Yeah.
pediatrics, is
Yeah.
not taken seriously by postgraduates in pediatrics.
Yeah.
This is primarily because the evaluation or the assessment systems that we follow.
Yeah.
Our systems are primarily based on theory knowledges. That is very important. Whether you are doing a standard MD course or you are doing a board examination like DNBE, there are theory papers which look at actually the bigger aspects of
Yeah.
or what we call as the round aspects of pediatrics. For example, you are more likely to find questions or related to other specialties like cardiology, oncology, hematology, which you may not be actually managing. Pediatric endocrinology forms only 5 to 10% of the theory assessment
Yeah.
your undergraduate and postgraduate education, and hardly nil in MBBS. So
Clean image.
there should be a way in which the students are focused towards that there is a specialty like pediatric endocrinology
Yeah.
that can come with a better theory examination, and also in the way that long cases, short cases, or
Yeah.
multiple cases are given.
Yeah.
Hardly any pediatric endocrinology cases
No.
are shown in your standard MD examination. So things like the objective structured practical or clinical examination
Huskies, yeah.
introduce stations, but 5 minute station showing a growth chart is not enough to
No.
learn all about pediatrics. So even it may be difficult, but there should be an effort from the current teaching faculty to incorporate not only pediatric endocrinology but also other specialities as a part of pediatric examination, because examination systems orients the way the learning is taken. I see that even I learned more pediatrics after passing MD while working as a senior resident, because that time I had to explain to my juniors how I could manage. The theory was not enough good enough for me to sustain
Yeah.
that clinical knowledge. Then I realized that nobody really told me that these are important.
Yes.
So now I realize that we have to structure or restructure our assessment examination in a way
Hmm.
that pediatric endocrinology also takes an important place. Not necessarily the long case, but at least some important space in our examination system.
That's so nice. And I think that's the right way, perhaps. What you said is why I also observed the same thing, and I also have that only one short case of short stature, perhaps, and some about rickets. These are the two cases only which we see that it could be a standard case in exam. And OSCEs, perhaps, in a more deeper manner or more detailed manner, rather, may help them. Final question to you, sir. One message or one thing which you want all postgraduates in pediatric endocrinology and the young colleagues to carry throughout so that they can be a better person, they can be a better pediatric endocrinologist, they can become not Dr. PSN Menon, but they can be a miniature version of Dr. PSN Menon. How would you like to address them?
I think there is no one answer to that question. One most important thing is to be aware of our
Hmm.
social and community needs in the field of pediatrics. Endocrinology, especially diabetes. Give an example. You may know all the most recent aspects of
Yeah.
how best quality insulins are produced,
Yeah.
how best a CGM, like
Hmm.
glucose monitoring, can be done, or
Yeah.
insulin pump. But your judicious selection of the right test, right medication,
Uh-huh.
right policies for managing the children with diabetes manages whether you have an exposure to the community.
Hmm.
So when my colleagues say that what is the best most important need of a diabetic child,
Okay.
sometimes we say I would say probably making insulin available. Somebody would say
Uh-huh.
making glucometer available.
Yeah.
My activist colleagues in the field of diabetes say most important is to make diabetes a disability in the
Yes.
government part, because that would absolve the diabetic children all the needs of painful that get a special certificate. Of course, CBSE has given going for examination, being denied admission in a school, denied admission in a career, because
Yeah.
several undergraduate and postgrad careers there is a ban of glycosuria. It is there. So we have to, I'm just giving an example of diabetes. I think similarly, actually, we would say that not no single child should be born with hypothyroidism without treatment. So there are several social awareness that has to come. So you have to advance in your field, but at the same time, you should be aware of the social, community, and other needs of the disease burden which produces for the society. It is very important to know about that, aware
Yeah.
of that,
Yeah.
rather than just advancing your
Yeah.
knowledge. That yeah, I today I have a lab test, today I have a more advanced test, tomorrow I have a WES or a.
Uh,
But our aim should be, and also I have seen that the curiosity to find a diagnosis overwhelms the care, medical care, many a times for a younger student, because some
okay.
unusual diagnosis, rare
Uh-huh.
diagnosis,
Uh-huh.
For the patient, it doesn't matter. For the
Hmm.
patient, matters is being told what the disease is and how
Hmm.
best to manage it within their resources. So keep the curiosity in check when handling difficult problems in field.
That's fascinating, sir, because I it's an eye opener for me also. Keeping the social aspect of a patient in always mind, being more connected to the patient in a social way, what the society needs, what the patient needs exactly, apart from being good in your career. Thank you so much for that lessons. And I actually had a very, very good time, to be honest with you, listening to whatever you have said and what imparted. I hope I can imbibe at least even 10% of what qualities you have, and you have mentioned it. I think I'll become a better person in coming time. Thank you so much, sir, for that podcast, and I'm really, really glad and happy to have you here. Thank you very much.
Thank you, Nikhil. It
Thank you,
has
sir.
been wonderful discussing my career with you.
Thank you, sir. Thank
Thank
you.
thank you.